Well, good afternoon and welcome. I'm Kara Dingus Brooke, the President and CEO of the Foundation for Appalachian Ohio. Thank you so much for taking time to Zoom with us today. We have educators here, healthcare professionals, community leaders, parents, FAO grantees. We especially want to thank those of you working with us on youth-led prevention and youth resiliency. And if you'd like, I know people are still coming in, but for those who are here, if you'd like to type into the chat where you're Zooming from and what organization you're with, we would love to say hello. We're truly grateful for the work you do for children every day. We also want to thank our partners, especially UnitedHealthcare, their partnership and the leadership of Kelly Reidenbach, who you will be hearing from soon, has been the driving force behind today's Zoom. UnitedHealthcare has just stepped forward in such a big way in working with us. They have generously sponsored our first Health and Human Services Pillar grants, which are focusing on childhood health, and you'll be hearing more about that. So we just want to say thank you. We also want to thank our panelists. I'm just so excited that we're going to get to hear from Superintendent Dan Kaufman of Cambridge City Schools. Cambridge was actually the inaugural site for FAO's Mobile Vision Clinic, and many of you have worked with us to solve the challenge of children needing eye exams and eyeglasses. And thanks to many efforts, nothing happens without partnerships. We're really excited that in the next 3 years, we'll be able to bring our mobile vision clinic to about 20 schools, reaching 10,000 students. So Dan, you've just been instrumental to that, and we really appreciate your partnership. We're delighted that Randy Leidy from the Appalachian Children Coalition will be joining us. We're just so excited to have the coalition working in our region and grateful for your partnership. And it's also wonderful today we'll be joined by Dr. Bodie from Nationwide Children's, and we've already had a little practice session and have lots of questions for her, even what do we do about trick or treat this year? So Dr. Bodie, just thank you for giving your time. This is going to be an amazing discussion. I'm very excited. I just will quickly give you a few more kind of level setting comments. At the Foundation for Appalachian Ohio, we focus our work in 5 pillars. We call them the pillars of prosperity. So today we're gathering around our health and human services pillar. As I think most of you know, our I'm a Child of Appalachia Fund supports the work of all of these pillars. And so we thank those of you who have been such generous givers to that fund. It makes such a difference. So today we're going to share data about children's health in the region. And then we're going to turn it to this panel for a close to the ground view of what they see going on with childhood health and school-based initiatives, opportunities, challenges. You're going to hear a lot of that. And we're going to start with UnitedHealthcare. And I just have to again say we could not be more grateful for their leadership in stepping forward and sponsoring our health and human service grants and doing more than just providing funding, but really engaging as partners in improving children's health in our region and in sharing this data. And we've just had the pleasure of working with Kelly Reidenbach from UnitedHealthcare. She is the Vice President of Strategy and Development. She's a joy to work with. She has a big heart for children and for Appalachia and has been a tremendous partner. And so I'm going to now turn things to Kelly, and Kelly is going to share with you some of what UnitedHealthcare sees in the data for children in our region, and then we'll share perspective from our panel, and then at the end we'll get to share more information about the grants program that will kick off this afternoon. This is exciting. You're here for the inaugural one, so thank you for joining us. I see all of your comments coming through in the chat, so thank you for that. And Kelly, welcome, and thank you so much for UnitedHealthcare's investment in our region. We appreciate you.
Kara, thank you so much for the kind introduction. And this would not be possible without the work of FAO and the other local partners that we have on the line. Especially want to thank the United team members that are on the line, the work that we are doing to serve our members in the community and ensuring that we are helping to promote the health and wellness outcomes for our members is really critical. So Appreciate the work of the team, the expert panelists, and all the members of the community that are part of this call. If you'd be willing, Kelly Mormon, to start the presentation, that would be great. So at United, we have a really robust population health team that works really closely with our different clinical teams to ensure that we are looking at the data at a very high level and aggregate level, and looking at certain trends that we see within the data. And we had the opportunity to work with the Foundation for Appalachian Ohio and the others on the phone to really discuss what we're seeing in this data and the real opportunity that we see to really address some of the disparities and make sure that we're closing gaps for children in Appalachia. Next slide, please. We saw that 450,000 children live in Appalachia, more than that, and that they make up about 17% of the population. We serve the Medicaid population and 3 out of 5 Appalachian children are covered by Medicaid. So we see it really incumbent upon us to make sure that we're addressing those health disparities that we're seeing. Next slide, please. We looked at our claims data and reporting, public health data sets, population health data, and a lot of the data that many of you utilized on the call to really say, where are those specific areas where we think we can start to make an impact in partnership with the community, because the work really happens at the local level. We want to make sure that we're supporting those efforts. Next slide, please. When we look at the areas of opportunity, these were some of the counties within the Appalachian region where we saw a lot of opportunity for some additional work. Next slide. And we continue to see behavioral health as a primary risk factor, which the panel will dive into more. So I won't spend a lot of time, but this deck will be shared with the audience following the call. Next slide. We looked at neonatal abstinence syndrome and infants at risk for NAS, and what an important issue that is to address. Next slide. We looked at dental concerns. We all know the importance of ensuring that folks are connected to appropriate dental care, especially children, and just that overall importance. Next slide, please. We looked at food insecurity and childhood obesity. We're seeing these SDOH issues as drivers of health outcomes and really want to make sure that we're impacting those appropriately. Next slide, please. We looked at lead screening opportunities and childhood immunizations and opportunities and gaps in preventative care for children, really seeing a lot of issues in that space outlined by the data and that our panel will dig into. Next slide. We looked at birth outcomes for teen birth rates, and you can see here some of the different rates and the counties associated with those differing rates. Next slide, please. Here's another slide on just the importance of making sure that we are monitoring NAS and looking at those birth outcomes. Next slide. And then we really thought about those opportunities to enhance health and outcomes for those children that are living in Appalachia and across the state. So, we saw a lot of opportunity in expanding access through community-based settings, specifically schools and after-school programs, which I know many of you on this call have a vested interest in and are doing that direct work. We saw the importance of focusing on the social determinants of health, including food insecurity, technology, and health promotion. The opportunity to address poor health drivers, including those dental outcomes, behavioral health disorders, and childhood poverty. Selectively working together on childhood immunizations and lead screening, seeing how we could partner with the provider community, the overall community, and our fellow managed care plans on impacting these measures. And then looking at how we can develop small-scale interventions to address health disparities. So I think that's the end, Kelly Mormon. So thank you so much for sharing that. Kelly Mormon will talk about some additional details of the grant opportunity, but we are so pleased to be able to partner with the Foundation for Appalachian Ohio to provide grant opportunities both in implementation and convening capabilities for the community. So I'll go over a few of those details and then turn it over to Matt for to launch the panel. But up to $50,000 will be available to support collaboration and capacity building work in the community related to collaboration and capacity building. Requests can be 5,000 to 15,000, though requests of 20,000 will also be considered. And we're really looking to partner in a very data-driven way, utilizing population health data and other public data sets to make sure that we are using a data-informed approach, but more importantly, a locally based approach to ensure that we're helping to close some of these gaps in care and some of these disparities. So without further ado, I'll turn it over to Matt to talk through and help facilitate the panel. And again, thank you for your time. Thanks, Matt.
Thank you, Kelly. If we can have our panelists join on camera as well at this point. All right, well, I'm Matt Kaido with the Foundation for Appalachian Ohio. I'll kick off our panel. We have Dr. Sarah Bodie. She's the Medical Director for Mobile and School Health Services at Nationwide Children's Hospital. We have Dr. Randy Leidy, the Executive Director of the Appalachian Children's Coalition. And we have Superintendent Dan Kaufman with Cambridge City Schools. Superintendent Kaufman, I want to start with you. From your perspective, both in, from your childhood to now your work as superintendent, how has school-based care evolved over time?
Yeah, I appreciate the opportunity to invite today to be a part of this panel to talk, about a couple of subjects that are pretty near and dear to my heart, something that I firmly believe in personally, and that our Board of Education at Cambridge City Schools is completely committed, invested in. So what a great opportunity to be in front of a large group talking a little bit about, the work that we're doing at Cambridge City Schools in hopes that we can continue to broaden the opportunities, the partnerships that we have to provide our students, but also for hopefully other districts in our area to potentially hear about some of the things that we're doing that they may want to implement in their district, and then an opportunity for us to continue to understand how others are partnering with different groups to provide these opportunities for our kids who live in Appalachia. The history here is when I talk to my Board of Education about these topics, oftentimes is the days of us being a school district that's just simply focused in on reading, writing, and arithmetic, the traditional academics that schools are charged with and mandated to provide our kids are long gone. The simple academic piece of this is just not who we are any longer, and we need to be as focused in on the whole child as we possibly can. And this is an initiative that is statewide to continue to focus in on all of the different aspects for a student to have the tools and the resources that they need in order to be successful ultimately in an academic setting for us. But then, as they transition out of high school and into society, that they have, the right tools in the toolbox. So, that continues to evolve. I would say that it's evolved significantly over the last decade or so, especially, my time in administration. What I've seen education look like over the last 18 years versus now is completely different. And then looking back on when I was, taking advantage of K-12 public education in Columbiana County, what I remember of that, to my time as a teacher, now as an administrator, 6 years now as a superintendent, is completely different. And we've got to continue to find ways to identify the gaps for our students, and then put genuine resources in place. And oftentimes we've been very successful with identifying the gaps and identifying at times the solutions to these gaps. But really what it comes down to is a strategic approach to an implementation plan, and then also follow through on that plan to put these tools in these kids' resources, in these kids' toolboxes, in order to be academically successful. So I think we're going to continue to see that need. That is not going away. Students at Cambridge City Schools, we have roughly 7 out of 10 kids walk through our door every day at or below the federal poverty guidelines. That tells me this is a long-term generational challenge. This is not something that we will fix overnight. It's not something that we'll fix during the duration of my career. But it's really it's heartwarming. It's extremely important to our district and to myself to know that there are these different groups out there, such as the FAO and groups like Vision to Learn and some of the partnership groups that I'm going to get into later in this panel discussion that are, taking a true, making a true effort in implementing plans and implementing solutions for these kids, not just simply identifying through data and statistics that the problems exist. We know they exist. And there's a lot of intelligent folks who are coming up with these plans, but we're blessed to live in an area where we have a group like this that's doing the work to create solutions for our kids. So I appreciate the opportunity to be here and talk a little bit about these partnerships that we're creating.
Thank you very much, Superintendent Kaufman. Dr. Bodie, appreciate you joining us today and taking time out of your schedule. From your perspective and your work with Nationwide, what community resources and relationships need to be in place for school-based care to be as effective as possible?
Thank you so much, Matt. I think this is such an important question, and I think Superintendent Kaufman kind of alluded to this. So, first to start, I just wanted to say, as much as educators have been through this transformation to realize that they have to have a whole child approach, the healthcare side has also been through a similar transformation, that we can't just exist the way we do now and take care of physical health within a 15-minute visit without understanding that we also need to be handling all of the education pieces and be aware of that, and homelessness and all the other social determinants of health. So we also have a similar framework that talks about needing to identify those solutions and being creative about that. And so now you have the healthcare entity side and the education side, hopefully having these two frameworks that speak the same language, that can now develop these partnerships to work together to really think about how school-based healthcare can transform some of the ways we do this. And so what do I mean by that? This is complicated. You can't just open up a clinic that happens to be close to or on site at a school and operate in the normal way that you do and expect that that's going to meet the needs of your community, right? You may already have a medical home that's a few miles down the street that maybe is not serving the needs of all the students in that community. So this really is a team approach to think about how do you look at the population as a whole in your district, identify what those gaps are, as Dan mentioned, but then come up with creative solutions about how you can partner to make that work. So, for example, what does your marketing look like? Are you working together from a school side and a healthcare side to communicate out to your families and your students what's available? What needs do they have? How can you help, and how can you connect into those services? I tell a little bit of a story about when we first started, and some of our marketing materials we were using were very NCH marketing materials, and they had a lot of words on them, and the graphics were not really kid friendly. And we were using these posters in some of our schools to try to get students to understand we had a clinic there and they could utilize it. And really what we found is they were ineffective, right? And actually we even had talk about how we needed to get posters in order to get the students to know while they were standing right behind one of our posters during a presentation that we had that really showed these were ineffective. So what did we need to do? We had to really work together with our school partners, with the students, with their families around messaging. What do we need to say? And really simplify that and get the message out. There's a doctor's office in room 203. Here is what they can do for your child. Here's what they can do for you if you're a student. Posters in the bathrooms that really talked about, what those needs might be for those students. And so thinking creatively about how we're accessing these healthcare services, how we're communicating with our students and our families to make sure that this is something we can all be working on together, and taking away those barriers, that it does not have to be that very traditional formal way to access healthcare. The other thing is just being creative around consent. too. So how are we getting parents? How are we pulling them in? How are they understanding what these services are? So I think a lot of times the details of the operation, again, as Superintendent Kaufman mentioned, they're really where the rubber meets the road on figuring out how do we work together as a team to make sure that when we do open these services, that they're utilized to their full extent. And that's really important.
Awesome. Thank you, Dr. Bodie. Dr. Leidy, I want to turn to you and your work with the Appalachian Children Coalition. Obviously, access is an issue. Getting more specialists into the Appalachian region is an issue. So how are you and the coalition tackling those areas, and how can we overcome some of those obstacles?
Well, I guess I'd start by saying, in terms of overcoming it, I think UnitedHealthcare is helping us to take a huge step forward just with their commitment to data-driven decision-making and making data available. We've talked to several dozen people throughout the Appalachian region, and really have heard over and over again three foundational issues that are a critical problem, and certainly a lack of workforce is one, a lack of access to broadband and technology is another, and then the third one is a lack of access to good data to use to make decisions. So I think United's commitment to that is going to be a huge step forward for us. I think it's also important to acknowledge that there's not a simple single answer. If there was, we wouldn't be talking about this, right? It would have been already resolved. I think we need a complex, nuanced, and very locally responsive set of responses. And I think what's critical in so many communities, the critical resource in so many communities is the school, because in many small towns, the school is the only resource. They tend to be highly trusted by the people who live there. And so I think to build models around school-based services, it really is the most effective route. I would advocate for very much of a hub and spoke model, one where you would have on-site services and clinics at some locations. They would be connected to other locations via telehealth access. And I think there's an opportunity to build a set of services that utilize a broad range of technology. I think in terms of what we do in school settings, certainly healthcare delivery is an important piece. The other piece I wouldn't lose sight of, and this goes to Superintendent Kaufman's comments, is to match healthcare delivery with social support programs, after school programs, summer programs that are really about helping to address patterns of social isolation among children, to give children resources outside the school day to complement the resources they're receiving within the school day. And then, as I mentioned, to do that in a very locally responsive way. I mean, what's of issue in a community in Belmont County may not be an issue in Chillicothe in Ross County, right? So we have to understand in a very localized way what's relevant. I think that's I already commented UnitedHealthcare. I'll compliment the Foundation for Appalachian Ohio because of their commitment to make local investments and acknowledging there isn't a single regional investment that's the solution. We've got to be very localized in what we do. As to the workforce piece, I think there's three strategies, three steps we need to take that we're trying to focus on. One is, how do we broaden the workforce? How do we recruit more people to the workforce? How do we potentially train other professionals to do work that they can and should be able to do to complement the work that healthcare providers do? That broadening the workforce is critical. But also, I think it's important to strengthen the current workforce, to find ways to enhance what the current workforce can do. Things we can do to broaden credentials, to broaden the scope of practice that the current workforce can undertake. And then the third piece to it, and this is the most challenging, is how do we better support those who hire the workforce? How do we support providers and employers to find the resources they need to fund programs and to fund staff, looking at things like alternate financing models, technical support. It's a lot of stuff there, but I think there is a way to think about those things connected and aligned in some way as we make investments.
Thank you, Dr. Leidy. And we're going to stick with you here. We saw in the United data, a key issue that in the region is behavioral health. So with your work, what are the short-term solutions and long-term hopes for addressing behavioral health issues in Appalachian Ohio?
Well, yeah, I think first it's important to understand, the risk factors that come into play with children in the region. And I would argue that when you're dealing with children in Appalachian communities, there's a different set of dynamics at work that may be present among children in other areas. Certainly, we've got some data that suggests there's a differential exposure to aversive childhood experiences, what we call ACEs, that there have been some research done that suggests that the children in the Appalachian region have a higher exposure to ACEs than other cohorts. And I think that certainly is something we need to deal with. I think certainly a huge impact is the fact that children are much more isolated from services and supports. That's what we're talking about today. How do we bring services and supports to the children versus making children go off and far away to the services and to sports? I was talking to somebody the other day at a community roundtable we were doing, who was telling me about a child they were working with who got sent to Denver, Colorado for foster care because they couldn't find a closer placement. I mean, that's just a recipe for failure, right? To take a kid that far away from their family and their friends and expect a positive outcome. So I think that isolation is something we have to address. Certainly I think, poverty, the lack of resources and the way they contribute as well. The one piece of data that United has reported is food insecurity rates, and as food insecurity is certainly an outcome of poverty, and I think we need to better think about that full scope of the social determinants of health issues. I think you'll see behavioral health problems decreasing, but then also there's a magnification that I just want to briefly mention. So a child is profoundly affected by the trauma of a parent's misuse of substances, and that is a factor in the child itself. Well, then, because of that substance misuse, now there's family disruption on top of that, and that magnifies the problem. So we have to understand both the primary and the secondary factors that contribute. I think the long-term solutions, again, to go back to the complexity, it's certainly the access issues we're talking about today, but it's also these broader attention to social determinants, and I think understanding that these are not isolated things. These are not snapshots. A child's exposure to trauma, we have to understand that as a extensive timeline of impact, right? And think about how we help kids over time dealing with that as well.
Thank you, Dr. Leidy. Superintendent Kaufman, I want to turn to you here. What are some different ways that school districts can provide school-based healthcare? We know Cambridge has been really creative. We're grateful for your partnership with the foundation on our mobile vision care. And also you've had a recent partnership with Muskingum Valley Health Center. Could you share some of those partnerships and how they operate, and how, solutions can be more than just, a physical space in your building, but they can be partnerships with health centers that exist in the area?
Sure. I think it's important for us to acknowledge and recognize. I had a conversation earlier today with a physician at a local hospital and about different things that aren't education related. But one of the things that we were talking about is, we've got to continue as individual organizations to realize in Appalachia, you can't do this alone. You can't have silos put up where we as a school district believe that we can solve all of the issues. And it really comes down to acknowledging that with whether it's with our city, with our park board, with Muskingum Valley Health Center, Ohio Health, or Southeastern Med, Vision to Learn, EFAO. How do we go out there and continue to find resources and partners that want to help benefit our students? Guernsey County is about 5,000 students. Cambridge City Schools is approximately 40% of that. We have a lot of kids from our county coming into our buildings every single day, and we need to understand that is I think someone said it a little bit earlier, we're a central hub in many ways, each of our school districts, and the quantity of students and adults who pass through our doors on a daily basis is significant. So once we've identified these problems and identify solutions, then that implementation plan goes into play. Partnership with Vision to Learn, quickly came about. We're coming up on a year ago that concept came to us. I believe Cambridge City Schools is the first in the state of Ohio, but I think there's many others who are joining in with Vision to Learn, where we knew we had students sitting in classrooms who could not see the smartboard, where they could not see the worksheet, the textbook, the Chromebook screen that they were using, simply because they had a vision. And by law, by Ohio Revised Code, we were compliant. We were doing the screenings and acknowledging that there were vision concerns and passing those referrals on where they needed to be. So, at the end of that process, we're compliant, but that didn't mean that the issue was being solved. That meant we just simply had passed the information along where it needed to go, check the box, and kind of move on. And unfortunately, at times that's the best that we can do. But there was an opportunity brought to us with Vision to Learn to simply stop just checking that box of doing the screenings and passing information along, and actually put an implementation plan together. When I think last spring we test Vision to Learn. If you haven't learned anything about it, I encourage you to get on their social media or their website, or to learn a little bit more about that program, because they come to our site with a van, with a physician to do the actual vision test for us, come back a couple of weeks later and fit the students with glasses. The kids get an opportunity to pick out the glasses, the frames, and have a little bit of a say in what, but the best part about that is when they came back that day, I think we fitted, if I remember right, 19 students at our primary building, our K2 building. So these are 5 and 6 and 7-year-olds who are sitting in a classroom and cannot see well enough to perform. So how are we establishing a foundation or a base of what they need in order to be a successful reader, or in order to be able to do math? And so seeing those 19 kids that day, and we did a nice activity with them to really kind of amp up and recognize these kids. Watching those kids put those glasses on is powerful. I mean, it's an emotional thing. So if you have an opportunity, pay attention to some of the work that Vision to Learn is doing. But that's just one partnership. I think I saw in the chat, there's someone on here from Muskingum Valley Health Center. And, I've worked closely with some of their administration there, and specifically their education liaison, Rick Volkerson. We've created an interesting partnership to provide primary care and also primary dental services, eventually hopefully some behavioral help through their organization. And I think we're going to continue to broaden what that partnership looks like. It goes back to Dr. Bodie's comment about it. We don't solve this overnight. I'm not an overly patient person. So when we put this plan in place, I wanted to see it, I wanted to see this thing robust immediately. What I've learned is we're doing good things with it. COVID slowed it down a little bit, but it just takes time to build the communication, to build the trust, to build the understanding of exactly how each individual organization plays a role in this partnership. But for instance, one of the things that we ran into immediately with Muskingum Valley Health Center was we knew we were going to have a transportation issue, because ultimately Muskingum MVHC's built a beautiful facility in the city of Cambridge, and it's about give or take a mile from all 2,000 of our students, depending on which direction you go. But we still knew we had a challenge in how do we get our students to that facility, because for us, being within a mile of that facility, it doesn't make a lot of sense to have on-site services yet. It makes sense to go to their facility. So, what fits best for the individual community is what you need to do and make happen. So, MVHC quickly partnered with us, and we were able to purchase a minivan, and, we'll provide the drivers, because we have compliancy things on our end and they have compliancy things on their end. But at the end of the day, it simply took some communication and some collaboration, and an understanding that none of us can do this alone. So figure out some of these details. That is moving a little bit slower than I like, but I'm optimistic that that partnership is going to continue to grow. I heard of a student the other day came in, had a toothache at one of our younger grade levels. That we actually had another dental service there, did a pre-screening on them, identified an abscessed tooth, and I believe that student's either already been scheduled for dental services or has received dental services. Hopefully we can do that off hours, weekends, whatever it may be. But my take on it is, if the kid's got a sore tooth, we've all had one of those before. They are not successful sitting in a classroom, with a sore tooth. So if we need to take time away from the educational process to put the kid in a van and then go pick the mom or the dad up and drive them to MVHC and get the abscessed tooth fixed, then do it. And I think that's what we've got to continue with these partnerships, is to, you see problem, solve problem, put solutions in place, and tear down these barriers between our individual organizations, and avoid the mentality and the pitfalls of who's making the money and where's there's the whole business side of all of this, and that has to be a conversation at some point in these partnerships. But at the end of the day, let's focus in on what's best for our kids and find a way, as large organizations as we are, to get this work done. We continue. I think we're going to, with some food insecurity partnership stuff and later in my message, but really this whole concept of figuring out ways to put partnerships in place that address how we educate the whole child is paramount for our kids today.
Yeah, thank you for sharing those examples, and also want to thank the Ohio Optometric Association for their work with Vision to Learn and increasing access, and Dr. Shane Foster has been working really hard increasing access to vision care for children in Appalachia. And the Ohio Treasurer's Office is also invested in this project through their Results Ohio program. So I want to thank them for their work. Dr. Bodie, I want to shift to you here. Kind of when you work with Nationwide and you're looking at success models or where barriers can be overcome in some of these partnerships, how do you advise communities?
Yeah, great question. Going to echo a lot of what was just said, and that is a couple things. One is, this really does take a solution-based, committed, integrated approach, right? So you are taking these large entities, a healthcare entity, an education entity, and you're working together creatively to solve an issue that the students are having. And it really takes a, at that micro level, at the school level, this dedicated, committed group. So if you're really going to do this integrated care and solve complex issues like, vision problems or food insecurity, then you need to have staff on the school side and on the healthcare side that are talking and meeting regularly and making those, creative solutions and plans, and are really committed. And what I said earlier, this isn't just about as much as I'm not a very patient person either, but as much as we want this to happen overnight, it really sometimes on a national level, if you look at it, can take about 5 years to be completely efficient with a new school-based health clinical operation. What do I mean by that? You might be ramping up the volume each year and serving more and more students as you go, and you're building it. And so you may start with one service and then be adding services as you go to get as comprehensive as you can. So you might be starting with vision and then getting to primary care and then getting to dental care and, adding on those things. And it's not all going to look the same. So again, to Superintendent Kaufman's point, you might find that for your particular place, you really have this gap need in dental, and those need to be on-site services, but maybe for primary care, that's a linked transportation model. There are so many different parts and pieces. So it really is thinking through those issues one at a time. And the other thing I would say is that this is getting done a lot around the state, and we have some different models and toolkits and people that have done this before and have those lessons learned. And so this is also a dedicated, passionate group of people about school health that's more than willing to share some of those different ideas, best practices, talk through what some of those barriers have been around consent or billing or registration or all the processes you need to think about and put into place. And so, knowing that you can kind of phone a friend and do that and share across institutions, school districts, or healthcare institutions, that's really helpful as well. And so I think that can be effective in getting you going a little faster than maybe you would be able to otherwise if you're able to stand on the shoulders of someone that's done this before.
Awesome. Superintendent Kaufman, food insecurity, obviously an issue. Can can you share a little bit what Cambridge has been doing, increasing some food services?
Yeah, so probably one of the key things we did is, quite honestly, we came to the point, to the conclusion that we knew we had food insecurities, and continue to have food insecurities. We haven't solved that problem, and I hope that it doesn't take 5 years to continue to solve those, but it takes time. We started this food insecurity conversation about 3 years ago at Cambridge, and one of the things that we did, we quite honestly, we outsourced our food services program. We made the decision, that was a local decision, to outsource to a third-party vendor, because that's what they do. But when we brought them on board, we communicated with them that we wanted to find creative ways to feed kids. So, we created a full-blown summer lunch program that's completely free to anybody who is 18 or younger, Monday through Friday. The USDA has been a great partner so far with providing free meals to our kids during the COVID times, finding ways to adjust our menus to make sure that our kids have options as many grade levels as possible. Giving kindergartners multiple lunch options is a little difficult. So, but beyond kindergarten, that's an ongoing joke with one of our principals, that with a 5-year-old, it's tough. But anyway, creating options, creating healthy choices for our kids, but also continuing to push the conversations about how do we create partnerships with our local churches and local Salvation Army to help solidify the work that they're doing. And those are ongoing conversations, that some of the work that they're doing, we can help with. We as a school district, we're a large entity. We do $1 million worth of food services a year. We buy a lot of food. Therefore, we have some leveraging power. So how do we help our churches and our Salvation Army, different organizations, and some of those partnerships are there, some of them are still to come, but how we can help with the ordering side, how we can provide meals. Our YMCA is getting ready to start an after-school program similar to a latchkey program of some sort, with different activities, and they needed a food services component. So we simply said, we'll provide the food services. We've got the means and the ability and the expertise to create that. We're trying to find ways to create a dinner program. Is one of my goals over the next 1 to 2 years, is I want to create a full-blown dinner program, because most of us, it's after 4 o'clock here in a little bit. When this call wraps up, we're going to go eat dinner. And how many of my kids went home and they had a good breakfast, they had a good lunch, but how many of them are going to go home and not have dinner tonight? And I take that personal in many ways, and I continue to impress upon our staff that we need to continue to push the envelope to find a way to feed these kids a dinner in some manner, with some partnership, some opportunity. So, if there's someone out there that has an idea or an opportunity, I'm interested in how we can pilot that, Cambridge City Schools to make that work. So, we found in these partnerships, unfortunately, some things just become, it is what it is, I guess, is one of my sayings, that, we found that they won't come to the food. So, and that was frustrating when we were providing free meals, and in many instances, they wouldn't come. So, okay, we see problem, solve problem, or we could have just seen the problem and said, we provided the meal, they didn't come. No, we found a way to start taking the meal to the different apartment complexes and different neighborhoods, and, trying to build trust and relationships there, and we literally school buses rolling in, with a couple hundred meals, stacked in the chairs within the, and they're stacked in the seats, and, kids come on the buses, or we take the meals out, set a table up, and we start serving kids in the neighborhood, or, dropping off meal bags, because some families don't want to come outside and take advantage of that. But we found if we left a meal bag that had 5 meals on the front steps, when you drove back through, the food had probably gone in the house. It just find those solutions, find ways to overcome those things, because 7 out of my 10 kids at Cambridge City Schools walk through the door at or below the federal poverty guideline. That clearly means these kids have food insecurities. So, we've got to continue to put forth the effort and create these partnerships to find ways to feed our kids.
We appreciate your efforts and your dedication. Dr. Bodie, if you could share some insights here on how critical it is to address food insecurity in children.
Yeah, thanks. just as they mentioned on the school side, I mean, on the healthcare side, we have the same challenges, right? So as we're seeing families in the office and we're trying to address their health, whether that's through obesity or undernutrition or whatever is happening at the time, we know our families have food insecurity. And so what can we do to help be a part of that solution? And I think, as was mentioned before, it's again, thinking about a holistic approach about how you solve this problem and utilizing those community partnerships. So, we know as a healthcare entity and as a pediatrician, I also take it personally. If I know that when this family is leaving and going home for the weekend from this visit to my office, that they don't have enough food, to feed their family, what am I doing to be a part of that solution? And I think, it's really thinking creatively about how you do that partnership. We all have resources. And so if we are working in isolation and setting up multiple different pockets of solutions for food that aren't getting utilized by our families, then how are we changing that? So, to the point, do we need to bring that food to them? Does it need to be on site at different locations? What are the skills or the resources we have at our healthcare institution to help work with our community partners, whether that's schools or after school programs or churches or other organizations that were mentioned? How do we set up that structure? And so that's something that we work on all the time as well. I also think that where do kids and families go and where do they trust and where do they spend a significant amount of their time? Schools. And so we know that. And we know that when they're coming into our healthcare office, they're coming in for a visit, a quick visit, but where are they spending the majority of their time? So how can we as a healthcare entity then go into the schools to help be a part of that solution for food insecurity? And so that's work we do all the time. So we can help be a part of that solution for summer food programs, after school food programs. What does that look like as far as nutritional guidance? Can we be helping with some of the education around that to families, around cooking healthy, all of those different things? So again, a focus for today, but it's really on partnerships and what is your specific role and skills that you can bring. And let's not do it alone, because you're going to be so much more effective if this is a community-based approach to problems that are significant like that.
Thank you, Dr. Bodie. And Dr. Leidy, I want to close with you. Considering everything we've discussed and the resources available and the resources we're trying to garner, how do we continue to build an ecosystem of community support around children's health and around school-based healthcare?
I think the first thing that we have to avoid doing is rushing to other people's solutions, right? I mean, if something worked in Cleveland or Columbus, that doesn't mean it's going to work in Cambridge, because Cambridge isn't Cleveland or Columbus. And so I think what we really need to do, and I guess this is going to build on comments my co-panelists have already made. I mean, Dr. Bodie made the comment that none of us can do these things effectively alone, or I guess it was Superintendent Kaufman said that. Dr. Bodie was reinforcing the fact that we need true community-based solutions, as opposed to what we don't need is any of us, Nationwide Children's, UnitedHealthcare, anybody coming into a community and saying, "Hey, guess what? We're going to tell you what you need." Right. And I think we've got a group of entities that are committed to not doing that. I think to build an ecosystem, we need to start with the points that have been made in this panel. It's got to be very collaborative. It's got to be inclusive. It's got to be partnership driven. And partnership is two-way. It's not me saying to you, here's what I'm going to do for you, or it's here's what we're going to do for each other, right? And making this work. I think it's got to be very locally driven and locally responsive. We need to deal with a community as a community. We don't need to deal with 32 counties worth of communities all together. We've got to get to the local community level and make sure that what we're doing is driven by the people in that community, that they are the ones identifying the issues, the challenges. They are part of finding the solutions. I think, to go back to my first point, anything we do has to be very data driven. We don't have the luxury of doing things based on assumptions or because somebody has a good idea. We've got to be well grounded in the data in everything we do. And then I think the other part of building a true ecosystem is to be very nimble. We're going to try things, they're not going to go well, or there's going to be problems, and we've got to be nimble enough to shift and modify as we go along. And I think if we do those things, those collaborative, locally driven data-driven, nimble approaches, we can develop a set of community ecosystems that really can lead us to all kinds of enhancements to the outcomes we're seeing in our children.
Thank you, Dr. Leidy, and I want to thank all of our panelists for joining us today and sharing your time and your insights and your stories. So that's all we have for our panel. And now I want to introduce Kelly Mormon from the foundation to launch our grant round.
Good afternoon, everybody. Again, we are so excited about the opportunity to be able to partner with UnitedHealthcare, but also want to extend our thanks to the panelists here today for sharing their insights and really highlighting the fact that school-based healthcare is really community-based, and that's what we're looking forward to do from our newly launched grant round in partnership with UnitedHealthcare, but through the Foundation for Appalachian Ohio's Health and Human Services Pillar of Prosperity, which is part of our larger I'm a Child of Appalachia Fund investment strategy. So this particular grant opportunity will support eligible projects that look at, one, collaboration and implementation projects related to school-based healthcare, drawing on the data shared today. And looking at what we mean by, one, collaboration projects, these projects will be looking at how we leverage health data from local sources and experts alongside the UnitedHealthcare population health data that was shared today to be able to discuss and analyze these data points and what we're seeing locally to be able to identify next steps to develop small-scale interventions to really implement school-based health strategies in our local communities. On the other side, the implementation projects will further facilitate connections between formal and informal health system partners to implement school-based healthcare interventions in local communities that are highlighting and including the health trends that we saw today, and those downstream causes, but also potential barriers to addressing those particular health trends and data causes. So applications will be open starting tomorrow, Friday, October 29th, and will be due on Friday, December 10th. And as Kelly Reidenbach shared earlier, grant requests will be between $5,000 and $15,000, though requests of up to $20,000 will be considered, and public and nonprofit organizations serving communities across the 32 Appalachian Ohio counties will be eligible. And for more information and to access the application as well as some of the resources shared today, we encourage you to visit appalachianohio.org / school-based healthcare. So again, we are so excited to be able to share this today and appreciate your time. All right, with that, I'll hand off to Kara to close us out. And if there's any additional questions, please don't hesitate to contact us at the foundation. I'll put that information in the chat, but we want to extend our thanks to the panelists today, and I'll hand off to Kara to close us out.
Thank you, Kelly. Thanks to everyone who joined us. Thank you, Matt, for facilitating a wonderful panel. And thank you to our panelists. We have just taken some wonderful notes and loved everything we heard. Dan, we will all go to dinner tonight about the 7 out of 10 children in the Cambridge School District. And so it just was an incredible blending of perspectives, and we really appreciate your time. Thank you to UnitedHealthcare for sponsoring this grant round, for stepping forward, not just with data, but with funding. And we plan to keep the conversations going. So I really don't have more concluding comments besides saying thank you. And we will be in touch with the launch of the request for proposals.